Right now in the UK, it is perfectly legal for someone with absolutely zero medical training to just buy a syringe of dermal filler online.
Yeah. And then inject it into one of the most highly vascular, intimate areas of the human body.
Exactly. I mean, they could do this in the back room of a nail salon or, even a hotel room, and it's completely within the bounds of the law.
It's a stunning regulatory blind spot, honestly. We are talking about invasive procedures being performed in anatomical regions that really require an intimate understanding of complex nerve networks and, major blood vessels.
Right. Well, welcome to this deep dive. For you listening, our mission today is to navigate a rapidly growing, highly debated, and let's face it, sometimes taboo sector of the aesthetics industry.
Definitely.
We are moving away from the public-facing canvas, the lip fillers and forehead smoothing you might present to the world at a dinner party, and we're exploring what happens when that exact same technology migrates below the belt. So the core question we are answering for you today is this. Is labial filler actually safe to have in intimate areas?
The aesthetic market is moving at lightning speed in this direction. And I mean, the technology and the medical applications are genuinely fascinating.
Oh, absolutely.
But the aggressive marketing campaigns are drastically outpacing the clinical evidence. We really have to apply a highly critical eye to what is actually happening beneath the skin here.
Yeah, and we have a massive stack of sources to help you do just that. We're pulling from clinical FAQs, from specialist gynecology clinics, stark safety warnings from the British Association of Aesthetic Plastic Surgeons, which is often called BAPS.
Right.
And we also have guidance from the Joint Council for Cosmetic Practitioners, plus active UK government consultations on unregulated cosmetic procedures.
It's a lot of ground to cover.
It is. We're going to cut through the glossy brochures, separate genuine medical benefits from those dangerous lunchtime quick fix myths, and basically give you the concrete facts.
Because when a needle enters this specific anatomy, the stakes are just significantly higher than, say, a bruised lip.
Yeah.
The potential complications can be life-altering, which means anyone even considering this needs a deep understanding of how these synthetic materials interact with our biological systems.
Okay, let's unpack this. Before we can even begin to evaluate the safety profile of these fillers, we really need to understand what the labial puff procedure actually entails, and frankly, why people are getting it in the first place.
Exactly.
And I have to push back a little here right out of the gate. When I first saw this topic in our source pile, my immediate thought was, isn't this just the beauty industry inventing a brand new flaw?
Right.
Like, are we just creating an impossible airbrush aesthetic standard for a part of the body that, nobody even sees?
I mean, that is a completely natural assumption to make, especially given how cosmetic procedures are usually marketed to us.
Yeah, exactly.
And yes, there is absolutely a subset of patients who seek out labial fillers purely to correct asymmetry or, achieve a certain look. Sure.
But what's fascinating here is the intersection of biology, aging, and daily physical comfort. Because for a massive percentage of women seeking this procedure, the motivation has absolutely nothing to do with aesthetics.
Right, really, nothing at all.
Nothing. To understand why, we have to look at the mechanical function of the labia majora, which are the outer protective lips of the vulva.
Okay, so they serve a specific mechanical purpose beyond just, covering the internal anatomy.
Exactly. They are essentially the body's natural shock absorbers. The labia majora are filled with specialized fat pads in these rich collagen structures.
Right.
But through the natural aging process, and particularly through the hormonal shifts of menopause, the body experiences a dramatic drop in estrogen.
Ah, estrogen.
Right. And estrogen is the hormone responsible for maintaining skin elasticity, blood flow, and collagen production in that specific tissue.
So without that estrogen, the tissue just basically stops maintaining itself. It thins out, it loses its fat reserves, and, well, essentially deflates. And this can also happen following childbirth or really significant weight loss.
Oh, how?
And for many women, that loss of tissue volume is a functional nightmare. The clinical sources refer to a resulting condition colloquially called sports vagina.
Sports vagina.
Yeah, because that protective cushioning is gone, the delicate inner tissues, like the labia minora and the clitoral complex, they become directly exposed to constant friction.
Oh man, which means basic everyday movements suddenly become agonizing. We're talking about severe chafing and irritation from just wearing a pair of jeans, let alone trying to exercise.
Exactly. Imagine taking a spin class, riding a bike, or going horseback riding when you have lost the biological padding in that area.
That sounds incredibly painful. You have delicate mucosal tissue and pelvic bone grinding directly against the saddle.
It initiates a relentless cycle of microtrauma. The friction causes swelling, micro tears in the tissue, and severe chronic pain. So for you listening, understanding this distinction alters the entire context of the procedure. For a vast number of patients, injecting filler is an attempt at functional restoration.
They're just trying to rebuild that anatomical cushioning.
Yes. So they can walk, exercise, and experience intimacy without pain.
That reframes it entirely. It is not just about chasing youth. It is about reclaiming daily comfort. So what is the actual material being used to rebuild that cushion? The sources mention specific brands like Deserial or Novia Rose. What is actually inside those syringes?
So the material is a highly specialized form of hyaluronic acid, or HA.
Mm-hmm.
Think of hyaluronic acid as a microscopic biological sponge.
Okay.
It's a sugar molecule that your body already produces naturally, specifically in your skin, eyes, and joints. And its primary biological job is to bind to water molecules. It can actually hold up to 1,000 times its own weight in water.
1,000 times.
Oh.
So when it gets injected into deflated tissue, it basically acts like a sponge soaking up a spill, just
Right.
drawing in surrounding moisture to create instant physical volume.
That biological sponge analogy is highly accurate. But the naturally occurring HA in your body breaks down and metabolizes in a matter of hours.
Oh, so it wouldn't last at all.
Right. So to make it last as a dermal filler, laboratories have to chemically modify it. They create cross-linked bonds, which essentially ties the HA molecules together into a stable 3D gel matrix.
Okay, I can visualize that.
This structural web allows the gel to hold its shape under the skin and withstand mechanical pressure for up to a year before the body finally breaks it down.
Okay, so we have a clear picture of the physical mechanics now.
Yeah.
We have deflated tissue causing extreme discomfort, and we have a synthetic sponge designed to reinflate it.
Exactly.
But that brings us to the core of our deep dive. What actually happens to the surrounding biology when you force a synthetic gel into a highly sensitive, incredibly vascular area?
Right. And here we have to separate the biological reality from the glossy clinic brochures. You will often see clinics marketing HA fillers as 100% biocompatible.
Yeah, I saw that a lot in the sources.
Because the body recognizes the HA molecule, systemic allergic reactions or rejections are genuinely rare. The most frequent side effects are localized responses to the needle itself.
Like what?
Just mild swelling, some tenderness, and bruising that naturally resolves as the tissue heals.
But the clinical literature in our sources paints a much darker picture when things go slightly wrong.
Yeah.
It's not all just minor bruising, is it?
No, not at all. The severe risks are profound, and they stem entirely from the complex vascular anatomy of the region. The vulvar area is supplied by a dense, intricate network of arteries and veins branching off the pudendal artery.
Right.
And the most critical, time-sensitive complication outlined in the medical data is a vascular occlusion.
Okay, stop there for a second. How exactly does a biological sponge cause an occlusion? Like, what is happening beneath the skin in that exact moment?
Vascular occlusion happens when the practitioner misjudges the depth or location of the needle. They might accidentally puncture an artery and inject the thick filler gel directly into the bloodstream, which creates an immediate blockage.
Oh, wow.
Alternatively, they might inject a large volume of the gel right next to a major vessel. Because the gel expands as it draws in water, it can compress the blood vessel from the outside. Think of stepping heavily on a garden hose.
Oh, I see. The flow of water just stops instantly.
Exactly. The blood flow is entirely cut off. The tissue downstream from that blockage is instantly starved of oxygen and essential nutrients. This induces severe localized hypoxia.
And if they don't fix it right away?
If the blockage is not recognized and reversed incredibly quickly, the cells begin to die. This cascades into tissue necrosis.
Meaning the tissue dies, turns black, and literally slews off the body. That is terrifying.
Yes.
If we are talking about a blockage acting like a crimped garden hose, what is the medical undo button? Like if a patient is on the treatment table and the blood supply stops, how do you save the tissue?
Well, if we connect this to the bigger picture, the existence of this undo button is precisely why the qualifications of the person holding the needle dictate the safety of the entire procedure. The reversal agent is an emergency enzyme called hyaluronidase, and it is a prescription-only medication. When injected directly into the occluded area, hyaluronidase acts like chemical scissors.
Chemical scissors, I like that.
It rapidly cleaves those cross-linked bonds holding the filler together, dissolving the synthetic sponge into a liquid that the body can immediately flush away.
So it basically releases the pressure on the garden hose and restores the blood flow.
Yes, but the window to act is remarkably narrow. A practitioner must possess the deep medical training required to spot the incredibly subtle signs of an occlusion.
Because I imagine it doesn't just look like a giant red flashing light.
No, not at all. They need to recognize blanching, which is a sudden whitening of the skin as blood drains away. Or they need to distinguish between normal injection discomfort and the agonizing, disproportionate pain of starving tissue. Furthermore, they must have hyaluronidase physically drawn up in a syringe, ready to deploy. If they cannot diagnose the occlusion, or they lack the prescribing rights to legally stock the enzyme, the patient is left to suffer permanent, disfiguring tissue death.
Wow. Here's where it gets really interesting and frankly terrifying based on the government consultations we read. The absolute necessity for emergency medical knowledge, the ability to prescribe emergency enzymes, the understanding of complex vascular anatomy.
Yeah.
You would logically assume that performing this procedure requires a medical license.
It is the most rational assumption a patient could make, yes.
But the Wild West reality of the UK aesthetic industry is that dermal fillers are not legally classified as prescription-only medicines.
No, they aren't.
Historically, they have been regulated more like medical devices or even cosmetics. Because of this historical loophole, there is zero legal barrier preventing an entirely untrained person from purchasing filler and injecting it.
It's shocking.
A beautician, a hairdresser, or someone who literally just watched a few online tutorials can legally perform a labial puff on you.
And this regulatory void is the primary target of medical bodies like the British Association of Aesthetic Plastic Surgeons and the Joint Council for Cosmetic Practitioners.
Right.
They are aggressively lobbying the government to shut down what they refer to as cosmetic cowboys.
Cosmetic cowboys. That really paints a picture.
Doesn't it? These are non-medical practitioners operating out of unregulated spaces like hotel rooms or the back of hair salons.
Right.
They lack the anatomical knowledge to avoid the pudendal artery branches, they cannot legally stock hyaluronidase, and they do not operate in sterile clinical environments.
And that lack of sterility introduces a completely different, horrifying risk that doesn't even show up immediately on the treatment table.
You are referring to the formation of biofilms.
Yes, exactly. Okay. Can you explain the mechanics of a biofilm? Because the sources describe it as a delayed complication that can strike months after the procedure.
Sure. A biofilm is an architectural marvel of bacterial defense, and it is an absolute nightmare to treat.
Okay.
If a practitioner fails to perfectly sterilize the skin, the needle pushes microscopic surface bacteria deep into the tissue directly alongside the synthetic filler gel, and the filler acts as an ideal vascular-free breeding ground.
Because there's no blood flow to fight it off inside the gel.
Exactly. The bacteria attach to the surface of the HA gel and begin secreting a sticky protective matrix called an extracellular polymeric substance, or EPS.
So it's essentially a fortress wall.
A highly impenetrable fortress. This EPS shield protects the bacteria colony from the body's white blood cells and renders them highly resistant to standard antibiotics.
Wow.
And the bacteria can lie dormant inside this fortress for months. Then, triggered by a minor illness or a fluctuation in the patient's immune system, they activate, causing a massive inflammatory response.
Oh, my God.
The patient suddenly develops hard, agonizingly painful nodules, abscesses, or granulomas deep under the skin that are incredibly difficult to eradicate.
This highlights exactly why the UK government is finally intervening. The ongoing government consultation we reviewed is proposing a brand new mandatory licensing scheme to end this Wild West era.
It's long overdue.
They are building a 3-tier risk system, categorizing every cosmetic procedure into green, amber, or red tiers based on the potential for catastrophic harm.
And genital fillers are not being taken lightly in this new framework.
No, they are being classified squarely in the red tier, right alongside breast fillers and the notoriously dangerous Brazilian butt lifts. The government is formally acknowledging the high risk of serious personal injury here.
Right.
Under these new proposals, red-tier procedures will be strictly restricted. They can only be legally performed by qualified healthcare professionals, doctors, nurses, or dentists.
Yes.
And crucially, they must be carried out in premises that are officially registered and audited by the Care Quality Commission, or CQC.
And CQC registration is not just a piece of paper. It mandates strict infection control protocols, clinical waste management, and audited emergency response procedures. It ensures the environment is actually equipped for minor surgery.
Which gives you, the listener, a very clear set of red flags to watch out for right now before these laws are fully enacted.
Exactly.
If you see heavily discounted flash sales on social media or, bring a friend 2-for-1 deals for intimate fillers, run the other way.
Yes, absolutely.
If the practitioner is operating out of a domestic living room or a rented salon chair, walk away. If the price seems incredibly cheap, they are cutting a major corner. They're either buying counterfeit, unpurified filler, operating without sterile equipment, or they have zero emergency medical training.
Finding a CQC-registered clinic with a board-certified doctor is the absolute baseline of safety. But it is vital to understand that a pristine clinical environment does not guarantee the procedure is medically appropriate for you as an individual.
All right, I look at the pre-treatment medical consultation like a very strict bouncer at an exclusive club. A good clinic should actively look for reasons to turn you away.
That's a great analogy.
The bouncer isn't just checking if you have the money to pay. They are checking if your specific biology is going to react dangerously to the environment inside. So, looking at the clinical contraindications in our sources, who is the absolute wrong candidate? Who gets stopped at the door?
The clinical guidelines are absolute. First, any patient who is pregnant or breastfeeding must be refused treatment.
Why is that? Is it just a lack of clinical trials?
It is partly a lack of ethical safety data, but it is primarily about the profound physiological changes happening in the body. Pregnancy triggers massive systemic vasodilation.
Meaning?
Your blood vessels expand and your blood volume increases dramatically. The vascular map of the pelvic region completely changes. Furthermore, your immune system alters its response to foreign bodies.
Yeah, I see.
Injecting a synthetic gel during this period makes the tissue response wildly unpredictable and drastically increases the risk of occlusion and rejection.
That makes perfect sense. What about localized issues, like infections?
That is another hard boundary. If a patient presents with any active infection, whether it is a yeast infection, bacterial vaginosis, or an active herpes simplex flare-up, the needle cannot come near the tissue.
Because of the biofilm risk we talked about.
Exactly. If you puncture infected tissue, you are mechanically tracking that active bacteria or virus deeper into the anatomical planes, directly into the filler material. You are practically guaranteeing the rapid formation of a severe biofilm abscess.
So if you even feel a slight tingle or itch, you just have to cancel the appointment.
Without question. Additionally, any patient experiencing unexplained postmenopausal bleeding must be turned away.
Wait, really? Why is that?
Because that symptom requires an immediate referral for an oncology review to rule out gynecological cancers. A cosmetic practitioner should never inject a plumping gel that could mask the progression of a serious underlying disease.
This brings up another crucial aspect of the bouncer analogy. A thorough medical doctor isn't just checking for physical dangers. They are evaluating if the filler will actually solve your specific problem.
Right.
The sources show that many patients request labial filler because they are experiencing severe pain during intercourse. They assume they've lost volume and need cushioning. But what if the pain isn't caused by deflation at all?
This raises an important question about diagnostic accuracy. A patient might be experiencing dyspareunia, which is painful intercourse, not because of tissue loss, but because of pelvic floor overactivity.
What does that mean?
This is a condition where the deep pelvic muscles are hypertonic. They are constantly guarding and locked in a state of extreme tension.
If the muscles are already tight and painful, injecting a thick volume of synthetic gel into the surrounding tissue isn't going to help at all.
No.
It's just going to add more physical pressure to a system that is already spasming.
It will likely exacerbate the pain significantly. A reputable medical practitioner acts as a diagnostician first and a cosmetic provider second. If they identify muscle tension, they will refuse the filler and refer the patient to a specialized pelvic floor physiotherapist to adjust the root muscular cause.
And what if the patient really is just suffering from menopausal tissue thinning? Is a needle really the only answer?
Not at all. True clinical ethics require exploring conservative, non-invasive therapies before performing an invasive procedure. If the primary issue is mucosal dryness and thinning caused by estrogen loss, the gold standard first-line treatment is localized topical estrogen therapy.
Like a cream.
Yes. By applying bioidentical estrogen directly to the tissue in the form of a cream or a pessary, you are signaling the body's biology to naturally restore its own collagen, improve blood flow, and thicken the tissue from the inside out.
That is so interesting. So what does this all mean for you, the listener? Let's bring all of these complex threads together. We set out to answer if labial filler is actually safe to have in intimate areas. Based on the clinical evidence, the answer is the synthetic material itself is not inherently dangerous, but the procedure's safety is entirely conditional.
Absolutely.
It relies absolutely on three uncompromisable pillars. First, the deep anatomical expertise of the injector to avoid vascular occlusion and deploy emergency hyaluronidase. Second, the sterile governance of a registered clinical environment to prevent those devastating biofilms. And third, a rigorous diagnostic consultation to ensure the procedure is biologically and medically appropriate for your specific body.
If a patient or a clinic bypasses even one of those three pillars, the risk of life-altering permanent complications skyrockets. True intimate wellness requires treating a body as a highly complex, interconnected biological system. It is not simply an aesthetic canvas to be plumped, smoothed, and monetized. As a patient navigating this rapidly expanding market, your deep understanding of these physiological mechanisms is your strongest defense. Knowledge is how you protect yourself from aggressive marketing campaigns and unregulated practitioners who view your anatomy as a profit margin rather than a medical responsibility.
Yeah, it is about equipping yourself with the facts so you can demand the standard of care you actually deserve. And that brings us back to where we began. We explored how cosmetic procedures have crossed the threshold from the public-facing areas of our bodies into our most hidden, intimate biology.
Yeah.
And I want to leave you with a final thought to mull over. When we observe the explosive rise of procedures like the labial puff, we really have to ask ourselves, are these medical advancements genuinely empowering us to reclaim our physical comfort, mobility, and confidence?
It's a huge question.
Or, by highly monetizing the natural biological aging process of our hidden anatomy, is an unregulated industry simply mapping out a brand new frontier of insecurities to profit from?
A profound dynamic to consider as this technology and the legislation surrounding it continues to evolve.
Thank you for joining us for this deep dive. Stay curious, stay informed, and we'll see you next time.